cannot.
Okay, that worked.
You got it? Okay,
Yes.
so you will record, yeah?
Yeah.
Yes.
Yeah, I see the record.
Yes, I will record.
Okay, so I think at 7:30 we want to start. I just took a couple of words to thank Professor Liao for organizing this meeting. It's extremely important for us, and we are very thankful for your time to share with us the experience. As I mentioned to Professor Liao, the idea will be, first of all, that we will learn from you your experience, but also to see with the questions if there are areas that we can collaborate and potentially from your experience and the experience that is growing here to come with some documents like a publication. Okay, and with that I pass to Professor Liao. I think Dr. Liao, she's frozen.
廖老师，
I think she has a problem with the connection because of time. So maybe
some problem with Professor Liao's connection.
Yes.
Internet because now it's 7:30 in China. It's in evening. Usually in this time, many people use the internet at the same time. So maybe she meets some problem. Okay, I think we can begin now, and I can introduce myself and my colleagues, and I can report my presentation now. And as I report my presentation, we can wait Professor Liao come out. Okay, so. First of all, I want to say hello to everyone. Good morning, every friend in America, and good morning, every friend in good evening, every friend in China. So I also appreciate for Professor Liao to give us a chance to talk with the doctors in America. Today, I want to share with my colleagues in America with this report, a challenge. Okay, let me share. Is it okay? Everyone can see my PPT now?
Yeah.
Okay. Okay. Tongji Hospital is the biggest, is one of the biggest hospital in Wuhan area. During the past 3 to 4 months, we, as a doctor in Wuhan, we meet many challenges. I think the COVID-19 is a new challenge for everyone, especially for the patients with COVID-19, how to do with them. And this is a problem for us, and I think now it's also a problem for the colleagues in USA. So today, I want to begin with 3 cases. The first cases, I meet it, sorry, wait a moment, how to shoot. Okay, no, okay, I want to show you the first case. I meet this case at January 22, and this patient is a normal patient with me for almost 1 year. Every 1 to 2 weeks, I will do the obstetric examination for her. So all of the time, all of the period during the gestation is everything's okay. At the end of January 23rd, okay, the patient is 79 gestation, and you know that we will get the Spring Festival, and the patient is a scar uterus because she delivered the baby last time with cesarean. So this time she also chooses cesarean to get the baby. So when I do the operation for her, she has no symptoms. Everything is okay. At that time, we do not check CT before the person is admitted into the hospital. So because this patient has no problem, so it was admitted into a general ward. But the problem come out after the operation is finished. The operation is finished at the morning, and that night, the patient get fever. The temperature is go to the 38. So at that time, our doctors do examination for her right now, quickly. And the first one is the CT scan, and the another one to do the SARS-CoV-2 gene test. But the CT scan is positive. You can show here. This one, we noticed that this one, it's I think it's very special pneumonia things. We can see that. But for this patient here, and another place is, yes, this patient is here. So the CT examiner tell us that this patient has this, is CT positive. And so the patient was moved into isolation ward as soon at almost we get the report. And the baby is also be taken back to her home. And the patient then get normal antivirus treatment. It's lucky that her syndrome is not severe. And at the February 20, the symptom has all disappeared. And the CT scan check is here. Everything is okay. And the gene test is also okay now. So this patient is dismissed, is discharged, and she doesn't go back home. She is sent to the isolation hotel. This is the first patient. And we noticed that for this patient, we do not get scan before she was admitted in the hospital. And this is the second case. And this case, the patient show us that she has cough and fatigue, and sometimes she gets fever. And during the gestation, the 40 weeks gestation, she go out to do examination. And when she go back from the hospital, she take a taxi. And she tell me that when she's on the taxi, she feel be catched by cold, and when she come back to home, she feel that fatigue, and sometimes the temperature will be higher than normal. So when she come back to me, it's February 22. At that time, the patient has a syndrome like cough, fever, and fatigue. For this patient, we do the CT examination and the gene test as soon as she came to our clinic. She is accompanied with her husband. We also do the examination for her husband also. For this patient, you can see here, for the right lung and here, the left lung, we can see abnormal things here. So also, this patient has the CT positive examination. But at that time, at February 2, we do not get the result of SARS-CoV-2 because at that time, the gene test need a little long time than now. So at that time, we do not get the gene test result, but we have a positive CT result. For this kind of result, she was moved from the fever clinic to an isolation ward. And because the patient made some another obstetric problem, the amniotic fluid is less than normal. So the patient gets the cesarean section at the February 4th. After the operation, she get a fever. She kept for fever for 2 days, and the operation was done in isolation operating room with negative pressure, and the baby was sent to the NICU. After the baby was taken out from the mother, and at that time it was sent to the NICU. For this patient, it's a special thing for her, and that her husband is also a patient. I will show you her husband's CT examination result here. So her husband was sent to another hospital, not in Tongji Hospital. So she and her husband and her baby stay in 3 different wards at that time. It's lucky that also that this patient do not have a severe syndrome. She just feel a little fever, a little cough, and a little fatigue. And she was treated by the antivirus drugs and antibacterial drugs. And the CT scan shows us that the patient recovered very quickly from February 12 to February 18. And this is the abnormal position. And now at the 18th of February, it disappeared. So also this patient is discharged from the hospital at February 25. So, and then she also stayed in an isolation hotel for another 14 days until her baby is 1 month old. She at last leave the isolation hotel and back to her home. It's a long journey for her family, I think so. And this is the second case. And the third case is another one. And she is a multi-para. And she came to our hospital as February 5. At that time, she has coughed for 10 days. But this patient without fever. And when she go to the fever clinic, also the CT and the COVID is tested for her. The results show that the CT is abnormal. You can see here. Also in the left lung, there are abnormal things here happened here. And the COVID result is also positive. So this patient is also a confirmed case. But this patient is a multi-para. She delivered a baby maybe 4 years before. So this time she also went to deliver the baby by herself. So we admitted this patient and put her into an isolation ward. And in that isolation ward, we wait until February 9. At that time, the labor began spontaneous, and at last, she successfully finished the vaginal delivery by herself. The baby is okay, but after the delivery, the baby is also be sent to the NICU. But where we finished the vaginal delivery, we also transfer this patient into isolation operating room with negative pressure. At that operation room, we finish the vaginal delivery. We do not finish this one in the normal place, and not in the because in the normal place we do not have fully protection for us and for the patient. The same as the above 2 patients, the patient also have milder syndrome. So, and at last, as February 28th, she is discharged from hospital and also sent into the isolation hotel. Okay, this is here I show you 3 cases. The 3 cases has I think they have their own characteristics. In fact, I want to tell you that from these cases, you will know that the doctors in Wuhan, when we meet the coronavirus 19, it's a new thing. It's a new challenge for us. From the December of 2019 to January 2000. At that time, we also do not know what is this disease. It really affects people by people. How to make diagnosis? Also, all of these questions needed us to answer. So when we meet the first patient, we also do not know how to protect us, how to protect the patient. But since the end of January, the patient's number come up quickly. I think also the same thing happening in USA, in the European. And so from February to March, we meet many pregnant patients complicated with NCOV. So at that time, we are trying our best to manage them. We want to give them the correct treatment, include treat them with coronavirus. Also, do the correct decision with their obstetric condition. So that's the period of from February to March. And from since the March of 2000 to 2000, the patient number come down again. We think the doctors, our obstetric doctors and other doctors in the field clinic, in the field department, we also will feel that the pressure come down a little. The pressure come down because one side the patient number is come down. Another side is that many doctors from all of China has come to Wuhan, where they give us great help. So we can have a time to do the correct things, to protect the doctor and the nurse, and to prevent the patient affected in the hospital. That's to prevent hospital infection. So from December of last year until now, we meet China doctors also meet the patient number come up and come down. And during this period, we get many things. In order to make a correct decision to treat and to treat the patients, so the China totally has public 7th edition of the diagnosis and the treatment scheme. We noticed that the 1 to 4 falls come out in January, and the fifth one come out at February 4th. It was a special edition. It's especially for Hubei patients. It focuses on the patient that if a patient with the clinic syndrome, but do not have a positive gene test result. For this kind of patient, whether we will think it's a coronavirus patient or not. At that time, as the 5th edition, we think, right, if the patient is in Wuhan, in Hubei province, okay, we can make the diagnosis just with the CT scan result. I think for this edition, it's made in February 4th. At that time, the patient's number is highest, almost the highest. So at that time, the doctors should diagnose as the patient come to you for the first time when the patient come to you, in order to find every patient. So we make this one addition, and now we also make some changement now. In the 7th edition, we focus on we will separate the patient into 2 kinds: suspected cases and confirmed cases. For the suspected cases, she should have the epidemiology history and the clinical manifestation. If she has one of this and one of this one, this patient, this case should be diagnosed as the suspected cases. In fact, for patient in Wuhan or patient in Italy, I think every patient will have, we will think that the epidemiology history is positive. And the symptom imaging characteristics, especially the imaging characteristics, is very special things for all of the patients. And the blood cell will tell us that the leukocytes, the percentage of the leukocytes is decreased, and especially the lymphocyte percentage decreased greatly. That is the characteristic of the coronavirus patient. So this tool will just if a doctor could get this one and this one from a patient, okay, it can be diagnosed as suspected cases. And if the patient get more result, for example, RT-PCR result or gene or virus gene sequence result or IgM or IgG result. IgM IgG result is conducted in the recent time. If a suspected cases plus one, any one from the three, it will be diagnosed as the confirmed cases. That is the key point of the 7th edition of diagnosis and treatment machine. So now we use this one to do our clinical work. So make a diagnosis is very important because after the diagnosis, we can know which patient is the suspected patient, which one is the confirmed case, which one is the normal case. And here is the flow chart of treatment in my hospital. We follow this chart. That means that each of the patient, when she come to our hospital, if she wants to be admitted into the hospital, we will do the epidemiology history, we will do the clinic manifestation check, and we will do the etiology examination for her. 3 will be done. Okay, and according to her result, she will be divided into suspected cases or confirmed cases. For suspected cases, she will be rewarded in a single room. She could not stay with another patient in one room. And for the confirmed case, it's no problem. It can stay with another confirmed case in one room. But this is the water choice. And if the patient is a confirmed case, usually she needs MDT. That means that obstetric, neonatal, infection, pneumology, and some other doctors might be needed for this kind of case. And when we do the treatment, in fact, we can divide the treatment into 2 parts. One part is treat with the coronavirus. Another part is treat with obstetric complications or obstetric problems. From my opinion, I think that the obstetric decision should be made based on the patient's obstetric condition, and it is not affected greatly by the coronavirus infection. Of course, if the patient gets a fever, that's another problem. The fever might damage the baby. So if we meet the fever, we will be very carefully to monitoring the fetal inside the uterus. And following on this chat, I think we have done great work until April 1, until the end of March. Well, totally 442 pregnant women finished their delivery, and are discharged from our obstetric department. And their total is 379 babies come out, and most of them are normal, do not have severe complications. In the 442 pregnant women, we find 21 confirmed cases, and the 33 are suspected cases. From this number, I think that the pregnant woman is seldom infected by the coronavirus. But this opinion is just my feeling. I think that I do not have correct number for it, because 400 pregnant women, only about 40 patients is completed with the coronavirus. So I think it's not so much, but also but the special thing that Tongji Hospital is the special hospital in Wuhan. We are restricted we have the duty to cure with the patient with the coronavirus. And during the past 4 months, none of our obstetric doctor and obstetric nurse was infected by the coronavirus-19. I think this is a great thing. No one is infected. Why we can do this? I think the protection is very important. And so this one is we do the operation, and this one is the delivery in the operating room. Okay, this one is for the baby and the mother to finish the early touch. Okay, and here anesthesia. Okay, so I think if the doctor and the nurse can practice ourselves in correct way, I think we can protect the virus outside, and we can cure it. China has endured the tough time, and this picture I want to show you that now Wuhan has a great change now. From today, the April 8th, the block of Wuhan is dismissed. People can go out from Wuhan now, but for the community, the government still encourages the people to stay at home. If you do not have work, if you do not go out to work, you should stay at your home as long as possible. But in my community, this patient, this elder women, do the morning exercise. This is the first time I see a person doing morning exercise since January 22 in Wuhan. Okay, so I want to show you this one, that the coronavirus, the virus is very a new thing, is a new challenge for all of us. But I think hope is in the front. If we do in correct way, we can cure it. Okay, that's all. Professor.
Okay. Thank you, Professor Hai, for your wonderful introduction about your experience, and also introduce the kind of the China's guideline. Okay, so let's come to the answers questions one by one. Okay, maybe the first question, maybe the first one to answer the question also Hai, right?
Yeah.
Hai. Okay.
Right. And the first question is, do pregnant patients seem to respond different to the initial infection? Okay. When I read this question, I'm not sure what's the meaning of initial infection, but I think maybe you want to know that whether the pregnant woman make the same response to the coronavirus as a non-pregnant woman. I think so. But in my opinion, that the pregnant woman, most of the pregnant women, they show us a mild syndrome, mild cough, mild fever and mild 这个 oxygen need. So when I discuss this one with other person, we all think that the pregnant women, if they completed with the coronavirus, they should short time to stay in the hospital. So, but for this question, we need to check the status of pregnant women and non-pregnant women, and we want to make the comparison, and with the data we can make a conclusion. But now, well, it's just a kind of feeling. I think that the patient, we do not meet a severe patient. Almost all of the pregnant women completed with coronavirus, they show a mild prognosis, a mild procedure of disease. So I think, for my opinion, the pregnant women seem to respond different from the non-pregnant women. Okay, that's my answer. Okay, the second question is about the adverse pregnancy outcome. It will be answered by Dr. Wu Jianli. Okay, Wu Jianli. Wu Jianli.星光，你在Professor 星光
Yeah.
Do
I'm
you
here.
know where is Wu Jianli?
I will contact him.
Okay, maybe I will contact him, and you can answer your question.
Third question.
The third question.
Okay.
Okay.
Can you hear me?
Yeah, I can hear you. Other people.
Okay.
Professor Liao,
And for,
you hear us? Okay.
Yes, we can hear you. We can hear well. Go ahead.
okay. Good morning, everyone. My name is Xin Guanglin. I'm in the same department in the same hospital of Dr. Hai Yi. And for that, I'm in charge for the second question. Do they have any suggestion for useful intervention or agents specific to pregnancy? And as we all know that there isn't any specific anti-SARS-CoV-2 medicine. And also, based on our data of both 21 suspected cases and 21 confirmed cases, I just want to introduce the treatment of pregnant women before delivery. I hope it brings some benefit. Because most of our cases of pregnant women in our hospital were moderate cases. So after these women came into my hospital, we usually routinely oxygen therapy via nasal catheter 3 times daily. I think this can correct the hypothermia and improve the oxygen supply for the fetus. And also, we observe that the early antivirus treatment may reduce the incidence of severe and critical cases. As agent, we use oxytamine, and gracyclovir, and all amidol tables. And we also use traditional Chinese medicine such as 金叶外毒, granule, and 莲花清瘟 capsule. And we think some COVID-19 patients were at risk of secondary bacteria and fungal infection. So the antibiotics can be empirically used in the following condition. More expectoration, especially that they have yellow sputum. And with the increase of white blood cell and or neutrophil increase, and some high body temperature. I think this may prevent the secondary bacterial or fungal infection. We usually use the second or third generation cefalozin and marlise. And another question, whether we can use the corticoids. I think this didn't affect by the infection of SARS-CoV-2. And we can use it in the premature fetal, guided by the obstetric guideline to promote the fetal lung maturation. And that's what we do in our hospital. Thank you.
Okay. I think Professor Jill will answer the question one by one, and after all of us finish their question, and then we will do the free communication. Do you think so?
Okay, so you don't want to take questions now. Yep.
Okay. Now it's the third question. Maybe we can go to the first question.
I think Dr. Gonik is putting his hand. Maybe he has a question, just to not forget. It's okay to take a question?
Yes, okay. Any question?
It's Bernie Gonik. Can you hear me?
Yes.
I was wondering, in the patients and in the newborns, do you have any samples collected? Amniotic fluid, maternal blood, cord blood, any of those things collected or frozen away?
Collected, for example, can you repeat your question? Well, collected the pneumonia data or what?
I'm interested in knowing, just for future studies, if you have any maternal blood, amniotic fluid, placental samples, and fetal cord blood stored away.
Stored away, okay.
You have frozen or storage. Have you stored any of those materials?
那老师，你来中文解释一下好了，这个地方我不是很确定。
那这个就是这种感染，这些人的血的标本和他的起血的标本没有？他问这个问题。OK， 就是你们这边
存储了没有 ？OK， 星光，you answer or I answer?
Okay, I will answer this question.
You answer this
because,
question.
We have some route to collect this infect blood, so it's very difficult to collect this matter blood or any sample. And we must if we want to collect this sample, we must apply for the hospital and agree by the department, and then we ask some special people to collect sample. So it's very difficult.
Do you give to all the patients
now we go
medicine?
to the first question.
I'm sorry?
Did you give to all the patients Chinese medicine?
Not all people.
Oh, not all.
Usually in China, we have treated the patient with Chinese traditional medicine. Just for very pregnant women. This is very important in China, especially in our Tongji hospital. Right?
Okay. And first question is about the vertical transmission. Professor Wang Shaoshuai, are you here? Professor Wang Shaoshuai?
Yeah. Now,
okay.
I will answer the question.
Okay, you answer this question, and I will connect with Dr. Wu Jianli.
Can you hear me?
Yeah.
Yes.
Okay, I will answer the question about the vertical transmission and the experience infection of the second trimester. We detected the SARS-CoV-2 by RT-PCR in placenta and cord blood of 3 COVID-19 patients. Were negative. So from the data of our hospital, there is no evidence to support the possible vertical transmission of SARS-CoV-2 from an infected mother to her newborn. That's the answer. Professor Liu, I finished the answer. Hai, can you hear me?
Yeah.
I finished
okay,
the
I
answer.
can hear you now. Okay. I want to try to connect with Dr. Wu Jianli, but I think she's a little busy now. Okay. Thank you for your answer, Professor Wang Xiaoshuai. And the fifth question is about the infection during the second trimester. I think this is also will be okay. Do you answer this question? Sorry.
Yeah, I answered the one.
You have finished these two questions. Okay. Okay. Xiaojian, are you here?
Yes, I'm here.
Okay. Xiaojian's question is about have there been any healthcare worker issue, especially related to the labor and delivery activities? So this question is answered by Dr. Xiaojian. Okay, please begin. Okay.
Thank you. Hi, everyone. Good morning. My name is Zhen Xiao. You can call me Jenny. I'm an attending physician in Tangji Hospital in Obstetrics department. Question number 6. Have there been any healthcare worker issues, especially related to labor and delivery activities? I guess you are asking about if there are any specific issues for healthcare workers like doctors and nurses related to delivering babies in patients with COVID-19. So I summarized the following 5 points. The first, an isolated unit for delivery and an isolated unit for cesarean section are applied for all of the patients with COVID-19. There are separated access for pregnant women and healthcare workers. Also, there are clean area, potentially polluted area, and contaminated area. A buffer area is set between the clean area and the potentially polluted area. In this case, to avoid the contamination. And the second point, an experienced doctor and an experienced midwife, both of them will put on their PPE. We call it 3-level protection before they get into the isolated delivery unit. The PPE includes N95 mask, surgical mask, and the glass to protect the eye, a full-face mask, and the protective suit, and gun, and gloves. Also, there are a neonatologist and an anesthetist are ready to get into the isolated unit as soon as they will need it, as soon as it's necessary. And the third point, we have to pass the training and the testing from the hospital about how to protect ourselves from COVID-19. And the psychological consultation service is also available for all these healthcare workers. And COVID-19 test is applied to everyone, to all the healthcare workers. Point 4, to be honest, at the very beginning, the fear of being infected is we are afraid. But so far, there are 0 infection in healthcare workers in our department. It's good to see all these people from hospitals all over the world, all over the nation. They come to Wuhan and help us. And the 5th, the pregnant woman can be only accompanied by one person, usually is her husband, and the accompanied person should be checked to make sure the one is not infected by COVID-19. And the pregnant woman should wear mask all the time, even during her delivery. And during delivery, her husband could only stay out in the clean area. He cannot stay with her. At last, tennis delivery service is now available, so which is good news for pregnant women. I think that's the answer to this question. And in conclusion, I think except a different delivery area and a complete protection of PPE, everything's similar as we have done before. That's the answer.
Okay, Xiaojuan's question has finished.
Yeah, I'm done. Yes.
Any problem? Okay. Okay, maybe we can, after this, after all of the questions be finished, we can do the free communication. And now, we will go to the next question. Dr. Wu Yuanyuan, Yuanyuan, 在吗? Are you here?
I'm here.
Okay, you will answer these questions about the screening of asymptomatic patients. Okay, you can begin now. Okay.
Okay. At present, we universally screen hospitalized pregnant women detected asymptomatic infections, suspected cases, and even confirmed cases. For pregnant women and medical staff, universal screening is a protective measure that can effectively reduces the risk of infection. If the pregnant women had no enough time for screening because of emergency, we treated them in the buffered area and performed the screening as soon as possible. Thank you. Finished.
And Dr. Wu Jianli maybe have some things to do. So about the second question, I will invite Dr. Lin Xinguang to answer this question. Xinguang, can you answer the question now?
Yeah. From all cases in our hospital, we didn't find any adverse pregnancy outcome in correlation with the infection of COVID-19. So maybe we can see some adverse pregnancy outcome, and it may be resulted by the obstetric syndrome. So I think it's not associated with the COVID-19 infection. Thank you.
Okay. All of the above questions are about obstetric. So this question is answered by obstetric doctors. Now I will introduce you the neonatal department
pressure room, and all the surgeons, nurses, and other staffs in the operating room were wearing tertiary protective clothing. So after initial resuscitation of the baby, the newborn was immediately isolated from the mother and the other family members and transferred to our neonatal intensive care unit by a neonatal transport team. So we will put the neonates. We transfer the neonates by a transport equipment. We call it transport incubator, to separate the infant from other people. And for the isolation, the monitoring the baby, when the baby admitted to our NICU, level 2 protective clothing for all medical staff was required. And the neonates was admitted to a isolation ward. It's class 3A for further observation. And we're monitoring the baby, including the vital sign, oxygen saturation, blood glucose, and neonatal jaundice. So medical and other equipment for these neonates were designated and not shared with other patients. So invasive procedures such as venous puncture or blood sampling was minimized as much as possible. For testing for all the neonates born to confirmed mothers, we collect the gastric fluid right after birth from the neonates. We also collect the neonatal throat swab samples and the feces samples at 24 hours and 7 days of life. So we collect the samples to test for the presence of SARS-CoV-2 by PCR. So we also test the coronavirus specific antibody, including IgM and IgG, but not for all the patients, only several of them. And chest X-ray was not routinely performed, except for the newborns with some respiratory distress or something, And for feeding, all the neonates were fed with term formula in our unit. And or the mothers should pump regularly to ensure lactation. And the supportive psychological care should be provided if the family needed. Yeah, that's the answer. Thank you.
Okay. Oh, very nice. Response to this question. Okay. Excellent. Okay. Dr. Hu Xiaolin, are you here?
I'm here.
Dr.
Yeah, I can hear you quite well. Yeah. Yeah, I can hear you. Sorry? Hello? Hello, can anybody hear me?
I think we lost her, or she has a problem with the internet. Maybe we can go on with your question.
Okay, my poor internet. Okay, I come back now.
Okay.
Dr. Hu Xiaolin, please begin now.
Yeah, I'm here. Yeah. So anybody, everyone can hear me?
Yeah.
Yeah.
Okay.
Yeah.
No problem.
Yeah. Okay. So I'll go ahead to my question. My question is, how do you manage neonatal early onset infection? I think this concept comes from the paper which published on March 26, which is on JAMA. On JAMA, it reports from Children's Hospital in Wuhan that 3 cases of neonatal early onset infection was reported. So I did read the paper again, and I found that all 3 patients has infection like syndromes. So 2 of the 3 cases have symptoms like fever and lethargic, and also 1 patient of the 3 had vomiting symptoms. So one of them is a very premature infant who is only 31 plus 2 weeks gestational age, and this baby has respiratory distress syndrome, pneumonia, combined with sepsis with E. coli, I think. So it seems that all the 3 cases has symptoms, and they also show that the chest X-ray for these 3 patients, all of them had pneumonia. So I and also from the laboratory test, They had leukocytopenia, lymphocytopenia, and elevated CK level. Respiratory support were given to all the 3 patients, and as well as antibiotics, but none of the patients were severe, and the RNA nucleic acid turned negative on day like 6 to 7 days. So I just did the literature review to introduce like the concept of early onset infection of COVID-19 in infants. But to be honest, in our NICU, I'm an attending neonatologist in Tongji Hospital. So in our NICU, we didn't find, we already admit more than 40 patients, infants born to COVID-19 mother. We didn't find any cases of neonatal, like only 1 case of neonatal infection, which was 36 hours after birth. So I also follow for the other like 40 patients. We didn't find any like early onset infection. So I did some follow-up for the 36 hours baby. I think everyone checked the literature from the paper published in Clinical Infection Disease. So actually, this baby transferred to Children's Hospital in our city. They did do the CT scan on this baby. So the CT scan, which was done on day 1, on day 8 of life, on day 14 and 15, all show a typical change. And the baby is quite uneventful. He transferred to the Children's Hospital with uncomplicated pneumonia and recovered quite well. And I know that the nucleic acid test turned out to be negative the 2nd day after admission. So this is the only like 4 cases I know about the early onset neonatal infection. On the other hand, when you check the literatures published in other place, like we already see like 4 to 5 case series published all over the world. Most of them from China and some from our city of Wuhan. And also we checked the like systematic review published just recently, which do the literature review for 38 cases of baby who was reported to born to maternal COVID-19. None of them found infection. So I think except for the 4 cases, most of the baby are not infected actually. So I think to answer this question, first you should be sure whether this is really early onset infection for neonates, or whether you it means that whether you really want to diagnose of the baby of early onset infection, or what is the concept of early infection. So I don't know for the sepsis of newborn. I don't know whether there are neonatologists here. For the sepsis of newborn, we define as early onset sepsis as 72 hours after birth. Before, if in fact the baby infected in 72 hours after birth, we call it early onset sepsis. But what about the COVID-19? How do you define the early onset infection? So is that early onset infection really means that the baby got infected from the mother, whether it's infected from the vertical transmission? And we all know that it's unlikely that vertical transmission are likely to happen, although we have 36 hours baby diagnosed of COVID-19. Is that clear? COVID-19 infection, but we don't think this is the solid evidence to prove that early like the vertical transmission. So I, as I mentioned just above, we admit more than 40 babies. We only found 1 like curious about the early onset infection. The other more than 40 no infection at all. So it's not a question about how do you treat the neonatal early onset infection. I think I would explain the question as how do you prevent the neonatal early onset infection. So I also checked another 2 papers, like another 2 cases. Actually, it's not paper; it's just a report. 2 cases which published, which report 2 cases in China. And those 2 babies got infected of SARS-CoV-2 at 5 and 17 days after birth. So, and it's very clear that both of the babies got infected from a family cluster. So one of the babies got infected from the mother, and the other got infected from the matrons. So this is, do you define it as early onset infection, or this? We all know that this may be like the communication acquired infection. But also I checked the clinical outcome of those 2 babies. It's quite well. Yeah, those babies got like slightly symptom of pneumonia, but recovered quite well. And one got queer fever. So, but we all know that what fever means in neonate. So as I mentioned above, if you want to manage the neonate early onset infection, it depends on how to not to manage it. It depends on how to prevent it. So as I say, as I understand, I quite agree with what we did and what Dr. Rong just introduced. So we should prevent the baby from infection, even from the second when the baby was delivered. So it means that as we did in our NICU, we will separate the baby from the mother immediately after delivery. We will prevent delayed cord clamping because we think that delayed cord clamping will expose the baby to like prolonged duration of to the virus. And also we prevent mother to infant contact to like it's also put the baby in the risk of COVID-19, and also in our NICU everyone wear like secondary level of PPE. It's not just to protect ourselves. We also want to protect the babies from infected from the adults. And also we do like we try to prevent the invasive procedure. We isolate baby for 14 days. If the result comes out to be negative, we can discharge the baby, and to make sure that baby can discharge home with some care provider who are not infected. And as we mentioned above, that we prevent breastfeeding. It's maybe you can judge about that. I think different people have different opinion about that. But in our NICU, we prevent the initially breastfeeding. And even the express breast milk was prevented in our NICU. We know that we cannot find the nucleic acid in the breast milk, but we're not quite sure. We cannot guarantee the process to process the EBM, for example, the mother pumping, the containing procedure. So we don't want to put the baby into any risk of the SARS-CoV-2 infection. So this is my opinion. So I don't know anyone has questions for me.
Okay. Any questions? Okay, maybe we can after Dr. Liu finish.
I think Dr. Goni has questions.
Any question? I didn't.
Can you hear me?
Yeah, I can hear you.
Yes, now we can.
Were any of the newborns tested for COVID IgG to see if there was maternal passive transfer?
You want to ask me this question, or you want to ask Dr. Liu? Because I think that Dr. Liu, the next neonatologist, would introduce this this concept. So I can answer the question. We did find that some baby got IgG from mothers. We also got IgM in the baby. But I think the question is a little bit controversial. We don't quite know about the underlying mechanism of the test. So I'm not sure whether this, as one paper published just recently, some people got found IgM in the baby. right? It's also published in JAMA. It's from another hospital in our city. And I'm curious about this result actually. And this is the same as we already found. We found four babies got positive IgM in our cohort. But we cannot find, we try everywhere. We try every sample. We cannot find any nucleic acid from those babies. So I did ask about the company about their reagent to check the antibodies of the SARS coronavirus. And I think they have some co-infection to previous SARS coronavirus. So I don't know or other core reaction may explain this phenomenon, but I think we are still investigating on that.
IgMs are notoriously falsely positive, so there's lots of reason for why that might be true without identifying nucleic acid COVID.
But it's possible also to transfer from the mother for those IgMs or IgGs, yeah?
I didn't think IgM transferred from the mom.
I don't think so either. I don't think so either. But as you may know now, that's the gold standard for the diagnosis of SARS-CoV-2 infections by nucleic acid, right? So although in our version 7 of the diagnostic guideline, we put IgM combined with IgG as the criteria to diagnose of the infection, but I don't think it's accepted to everyone. So as I mentioned, I also think that nucleic acid is a gold standard. So if you don't find nucleic acid, you only find IgM, you should be quite cautious about that. And you should consider, firstly, you should rule out any infection like I just mentioned just now. And maybe it may, by some the technology, it depends on the technology of the test. So is that clear? Okay.
Okay, maybe we can hear from Dr. Liu Wei, and he also will talk about the serological criterion and the serological test, and so maybe we can discuss when Dr. Liu Wei finish. And Dr. Liu Wei, are you here now?
I'm here.
Okay.
Okay.
You can begin now.
Okay. I am Wei Liu. I am your neonatologist in Tongji Hospital. I will answer this question. There are two ways. One is to directly check the viral nucleic acid in the blood of the newborn. If it's found, it can confirm the infection. But so far, no SARS-CoV-2 in the blood has been found positive. Another method, another ways is to test IgM and IgG antibodies in the serum. If the antibody level, the IgM level increase, it indirectly indicates neonatal infection. That's the answer. Thank you.
Yeah. Do you have any question about this one, Dr. Bernard? Okay. About the 10 question, we have finished the answer. But I think about this disease, about the virus, we still have many things to research on it. Professor Jill, do you want to say something?
Yes, there are a few questions that were sent in the chat, and maybe I read quickly, and if somebody can answer those. We have a question that what dose and how many days of systemic corticosteroids were we given to pregnant women?
Wow. 哎，小娟听懂了吗 ？Translation. My point.
Is anybody who can answer that question? Or
他就是说，那个我们对孕妇用不用激素时间？
这声音听的各种奇怪。OK，
海叶，就是说对于那个无症状的这样的人，就是你是不是就是给那个孕妇就是说是不是给那个就是可的松给多大的剂量用多少天？就是大概问这个问题对孕妇来说，就是可的松的应用就是激素用多少多少
？Okay, I think this question should be answered by Dr. Lin Qingguang.
Okay, I think whether we can use the glucocorticoids is depend on whether the baby is premature or as according to the guideline of obstetric guideline. If the baby is more than 35 weeks, and I think it's not necessary to give the cortisol. And we usually give the dosage is 6 milligram BID for continue for 4 times. Total is 4 times.
I think, Professor, you want to know use the cortisone to cure the coronavirus infection, or use the cortisone to do with the obstetric, for example, preterm delivery complications? You want to know which one?
Yeah, the question came from Dr. Anita Shalal. So are you still there?
Okay.
I don't know if still we have some time to additional questions from the side here in the US. If you have a question, please just click the unmute and bring the question.
Hello, sorry, yes, I'm still here.
Anita, you want to add to your question?
Yes, I'm not necessarily interested in what you guys were using as a cure, but if a mother was coming in with hypoxia requiring oxygen, what was the dose of steroids that you used and how many days of systemic corticosteroids were given? So it sounds like 4 doses total, 6 milligrams twice a day. And was that only if the woman was hypoxic?
I'm so sorry, we have any experience for these patients, because in our hospital, we have found any woman get a COVID-19 very, very severe infection. So we just find most of the pregnant women get the COVID-19, just very, very mild. So we need to use these drugs to treat this virus infection. No one patient needed to use the ventilator. So we have any experience about use the cortisone to treat these patients.
I see, thank you.
Yeah, okay.
Since we are reaching almost more than an hour, I don't know, Dr. Goni, you want to maybe mention a little about the situation here in the hospital? Let me unmute you, or maybe you have to unmute. And then any summary of what is the situation in the hospital here?
Well, I don't know. Is Dave Bryant on the line? Because Dave would be better off answering that question.
Oh, I don't know also if CD is online.
Yeah, I'm online.
Oh, you're here. Good.
Yeah, I'm online. At Detroit Medical Center right now, we have 7 confirmed cases, and we have 3 delivered. and the 3 patients, the delivered fetus actually is negative. And I do agree that only 1 case because IgM positive, and that can be co-infection, that can be secondary to false positive because the PCR are negative. So at this time, I do not believe that's because the vertical transmission. And plus, right now, the study has been showing that the placenta probably does not express the receptor. That's called ACE2. And that's the reason that you don't see the vertical transmission. Our experience right now is that the mom, we do not have any cases went to the ICU. All the mom doing okay. And 5 cases not delivered yet, but still stable. And we have 2 cases right now under the hydroxychloroquine. And I believe that's another hot topic, discussed right now. And we did not see anything side effects so far. And so pretty much that we can see the cases at Detroit now is going to increase. Our hospital have 2 sister hospital. The other hospital called the China Grace Hospital have 2 cases, and the other one we don't have it. So right now total we have 9 cases. I'm following up every day. And I don't know Henry Ford. We do have a Henry Ford MFM group here. Probably they can make some comment, and that's our hospital so far, the statistic.
Thank you, Dr. Su. Dr. Servos, you are also there. I don't know if there is any MFM or OB from Henry Ford, or maybe you can summarize. You have to unmute. You have to unmute.
Okay.
Hello. Okay. Can you hear me now?
Yeah.
Okay. So I'd like to thank everybody for participation in this meeting, and of course thank our colleagues in China for giving this excellent presentation. We learned a lot from you from this presentation. I had the opportunity with Dr. Moore to visit Wuhan in November, and had a very nice visit where we visited Tongji Hospital, the School of Public Health, other hospitals and university. This was part of our collaboration in reproductive health that we have between our university and the hospitals there. We look to continue to build on our collaboration. When I was there, I also met with the infectious disease doctors, and I remember in our discussion, we talked about emerging infectious diseases, and who would know the next month we'd have the biggest pandemic that has occurred this century. I also want to congratulate the Chinese people, the doctors, the nurses, especially for the work that you've done to control the virus in China, but also to provide this information for us to learn from you. Thank you again for coordinating and participating and leading this conference, and we hope to stay in contact.
Thank you.
Thank you.
Thank
Dr.
you.
Liao, if you want to finish, Dr. Liao, and I want to join what Dr. Servo say, thanking everybody for your time and for sharing your experience. Dr. Liao, are you there?
Dr. Liao, Professor Liao, Liao 老师 Okay.
Okay, so maybe you can wrap it up.
Yeah, can you hear me? Yeah? Okay. So can you hear me?
Yes.
Yeah, okay.
We can hear you.
I'm back. So this is a very special meeting. And also I once talked with Gil. This is maybe it's a cloud meeting, right? For the reason of well-known reason. So regarding this wonderful meeting, before the end of this meeting, I would like to thank Professor Gill and Professor Zavers for advocating this wonderful meeting. And especially, I would like to thank Professor Gill to co-organize this meeting. And I also would like to thank Professor Feng and Zhen's team from the Obstetrics department, and Professor Chen Lin's team from the Leolator department, for their hard work, especially on the preparation and organization of this meeting. And also, I would like to thank Haikun there, and for the help. Especially from the medical office of the International Exchange Center, especially for the help to this wonderful meeting. And I think this is a really fantastic meeting. I hope all of us keep in touch, and I'm looking forward to the next meeting. Thank you for all the participants. Thank you.
Thank you, and
okay, thank you.
Thank you, and goodbye, and again, a lot of strength in this battle. Thank you, everybody.
Thank you.
Thank you, Professor Jill. Thank you, Professor Liang. Okay.
Bye.
Bye.